I really loved the medicine in the emergency department. I did not love the politics. I have patients that come in here and cry when they see their before and afters. They all came in with the same mission of just wanting to be treated the same as they always had, to be treated with respect. These treatments help them show up in a way that they did not feel that way.
Welcome back to the Dr. Moe Show, where we talk about having the freedom to shift. And what that means is that success happens in focused transition. So when you are moving from one career to the other, one health journey to another, there is a shift that has to occur, and it has to happen in a sort of systematic way for it to be successful. So today, I've got English Black, and we have been waiting for this call for quite a long time. So thank you so much. If you could give our listeners a little bit of an intro, who you are, what you do, that would be great.
Sure thing. Yeah. Thanks so much for having me. My name is English Black. I'm a physician assistant of around 23 years, and I practiced I started my career in emergency medicine, transitioned over to dermatology. I actually had some character building years working two jobs at once, and turned out I love dermatology because as a PA, got to treat kids, elderly, save people from cancer, but also do some of the fun, foofy stuff. And then the changes in medicine that have happened over the last few decades, decided to open up my own med spa about 3 years ago. So here I am.
A fun journey. So I have a question, personal question,
Yes.
of course.
Yeah.
When you shifted from emergency medicine to dermatology, what did that feel like for you? I mean, I know what it felt like for me going from emergency medicine to lifestyle medicine, but what did that feel like for you leaving emergency medicine?
Well, I certainly had mixed feelings because I really loved the medicine in the emergency department. I did not love the politics. So while I was going to miss the patients, the interesting cases, the learning, made some amazing friends there, had tons of fun. ER tracks some characters for sure. And so, yeah, I had mixed feelings about that. But I honestly, for me, it was a bit of a relief because I'm actually asthmatic, I'm on inhaled steroids, and I was probably sicker than half my patients a few times a year, just being slightly immunocompromised. And it's a stressful environment. And the last group that I was with, half of the physicians really loved having PAs and the other half really didn't. So it was kind of a tough place to be.
So when you went to dermatology and then shifted into owning your own environment, owning your life, really, that's a bigger shift, in my opinion, going from traditional. The traditional path is pretty laid out, right? You go to school, you check the boxes, you finish the exams, you practice in whatever clinical scenarios you're required to practice in, and then voila, there's your job. When it's your job, we're not going to stop this from happening. Those of you who are listening later without video, there are cats walking by.
I love that.
So from the traditional aspect is one thing. It's pretty laid out. Once you decide to create your own world, create your own employable world, you help others through employment, you provide jobs, you create something from nothing. What did that feel like for you?
It's been an experience that I didn't know I was dying to have. And
Well
luckily and it's been great timing. It was a similar transition out of the ER to dermatology. I mean, I was still practicing medicine and saving lives. That's how I still found my sense of purpose. And of late, I had transitioned into a clinic where I did only injectables, facial rejuvenation, and then a blend of medical dermatology and that. And I've kind of been riding this wave of this blend over the last 15 years. And in my local area, medicine is very complicated these days. And frankly, I'm too old for this, some of this drama. And in my community, there's a definite need for someone who helped patients feel great about themselves aesthetically and did it ethically and did it well. And I was like, I have a niche to fill. And while I might not, and actually I have saved people from melanoma that have come to my clinic that have been getting treatments elsewhere that it wouldn't go away. I'm still able to do that, maybe not quite as actively. But I loved your quote the other day that said, there are more than one ways to save a life. And I have patients that come in here and cry when they see their before and afters. And so the patient care and that sense of purpose, it gives me chills talking about it now because it's so fantastic. And then the journey of working with staff and employees and learning and growing about business in general. And I kind of smelled that, so to speak, coming into it. I was like, I've been practicing dermatology now for around 20 plus years. And I think it'd probably be good for me to learn a new skill. And this new skill of running a business, it's like a mirror, isn't it? You know, we have to not only look at the business and how things are running, and I'm all about efficiency. It's a big character trait of mine. And it's a mirror of we're learning about ourselves while we're working with everyone around us. So I have really enjoyed all that. And it's been refreshing, enlightening, terrifying. It's like your
It's
own
funny you
movie.
say that. You said, what you just said was, I thought I needed to learn a new skill. Little did you know that this new skill would come in like a rhinoceros.
Oh my gosh, isn't that the truth? I mean, and to be honest, some of I had very low expectations, which, is unfortunate because we've done a great job in spite of ourselves. But I came in with extremely low expectations. And for us to have achieved what we did in our first year was pretty remarkable. And it has really set me on fire as far as the potential, to do more.
I think that's interesting. I have a similar path where, like you said, we've succeeded despite ourselves because I didn't know what I was doing. I mean, I started when someone online said, "Hey, you're a doctor?" When I was kind of helping people out, just sort of, just I was helping people through a similar journey that I was having. And I remember my first patient said, "Can you be my doctor?" I'm like, "I don't know, maybe." And that's how it started. And I thought, oh, well, maybe I could decompress, which is what I help healthcare providers, mostly physicians, but I will obviously take the right other people because you've got to have a mind to be a little off, to want to create your own thing.
For sure. For sure. Yeah.
And not everybody wants it. Not everybody wants it.
No, not everybody does, and it's not for everyone. It's like you were just saying. You got to have a little bit of a wild hair, sense of adventure, certainly a sense of initiative, and that sense of purpose is so important. If you don't have it, it's hard. It's like your own why. I call it sense of purpose. You can call it whatever you want, but if you don't have that drive, I could see burnout happening very easily. And again, learning about yourself and learning how to pace yourself, learning what's a valuable spend of your time, what isn't. And especially, I think, as healthcare providers, we are so independent. We're great problem solvers. And so it's very tempting to do it ourselves because that's what we're used to doing, with the exception of giving orders or for other people to help us with in the medical sense, but not in a business sense. So, and we're very used to functioning independently. So that has opened up a whole new world.
Right? I mean, how many times in this business journey have you said, "Oh no, I can figure this out"?
We are
Just don't.
transitioning.
Whenever, so if I can impart any business knowledge from my limited experience, if your brain says, "Oh, I can figure this out," don't. Just hire somebody. Just
Yeah, I mean,
ask for help.
what has been your biggest delegation filter? Like, how do you decide that?
So I wish I would have done things a bit differently, which it's so fun to talk to you as a PA because I get to like sit in my real wheelhouse here. I mean, I love the shift, right? I love everyone's shift, especially a lot of people come on here with health shifts, all kinds of things. But for me, I wish I would have done things so differently. I mean, that book up there, Buy Back Your Time, had I read that, how dare he write it 2 years too late, right?
I think we
Had
need to
I
write him a letter, an email.
I know, right? A strongly worded email. Now, I probably wouldn't have listened anyway because I'm pig-headed and I would have
Yeah.
said, "No, I can do this myself."
Right, right.
Fiercely independent sounds better than pig-headed.
Yes.
And when I think about this, and the biggest thing I think is I would have hired differently. I would have
Yeah.
What happened? I got too many patients and my response times, because my practice is 100% remote. So my response times got too long. So I had too many patients. So what did I do? I hired nurse practitioners
Hmm.
to help me because that to me made sense. In the traditional medical model, that made sense.
Right, right.
When instead, and it's funny because it's made me look at traditional medicine the same, and it started to make me not fit well in the ER anymore.
Mm,
Because when you have a physician who's writing their notes, and yes, we have scribes, but writing their notes, calling the consults, putting in an admit order, doing these things that you know very well could easily be done by someone who's well trained.
right. About your hires, What was the lesson, the take home for you about these hires that you wish you had known or had more insight on?
So I hired people that were on the ground with me because I trusted them. So I made the most fantastic hires as far as nurse practitioners because I had people that were literally overnight with me. I only worked nights in the ER. Overnight with me, keeping the department literally alive. I'm running traumas, they're running the back end, and life is good. So I trusted them, which was great. That part was 100% perfect. Ever, when I asked them to expand their duties into helping me grow the business, helping
Yeah.
me do that part, I ended up really putting them in a position that wasn't fair to them.
Hmm.
And I paid for a lot of hopes and dreams, which made me be angry because of my expectations. I expected them to have the same drive that I did,
Yeah.
that same entrepreneurial spirit where, no, we can do this.
Hmm.
But if you judge a fish by its ability to climb a tree, it will always fail.
Hmm.
So I put them in a terrible position instead of doing things differently. I'm very glad that we are where we are today. But that is one thing that's why I coach physicians, because you're going to do it the way I wanted to do it, because that's what you would think, right? I have too many patients. I need someone to help me
Yeah.
take care of the patients.
Yeah, yeah, yeah. Yeah. Yeah, for sure. Mine was similar. I mean, I was very lucky. Some of my first hires were, well, one of them was very entrepreneurial and had tons of initiative, and that was unexpected and much appreciated. On the other hand, there was a lot that I did not screen for, and I have been learning all along the way of, because to me, one of the most important things was like, how do you interview for honesty? How do you interview for transparency? That's one of our core values. And I've learned we have to ask questions that put people in a situation that would require transparency, but very uncomfortably. And how would they respond? It's a tricky thing finding just that right team.
Yeah, yeah. And I luckily haven't had a terrible experience with truly dishonesty, I guess. Oh, maybe I have. Now that I think back, no, yeah, it's human nature.
It
And it's
is.
because people don't want to be dishonest.
No, that's right. That's right. They want to do a good job. I mean, everybody does.
Yep.
Yeah,
Yep.
nobody
And
comes to
everyone
work and
comes
says,
in, wants to
yeah,
please you, wants to help the patients.
yeah,
I can do this. And then if they can, it falters. And that's where it gets hairy.
that's right. That's right.
Yeah.
So
So as far as building out, as far as growth, where do you see the biggest opportunities for your own ability to grow within creating this business? Because we both know that work isn't everything.
for sure.
Do you ever
By that,
find that it takes over because you want to do so much that it takes over? Like, how do you grow in a business and not have it take over your life?
hiring.
Yeah. Right?
Yeah, that's for
Let me
sure.
reiterate.
That's right. That's right. I mean, and that is not kind of, that is where I have found my place. And actually, I'm in a very, frankly, ugly phase right this minute because we are transitioning our electronic medical record. I have two new provider hires, and one of them is highly seasoned, highly just a fantastic human in general. I've known her for many years, and but she's been out. Long story, but they closed her clinic last minute, and because a hospital bought it, and they didn't tell anybody. I know, crazy, but she has been out. So we're building both of them back up while we're doing this transition, and so I keep telling myself, there are times where we do have to put our nose to the ground, whatever, the pedal to the metal, and just keep going to get to that place. That's the goal, is to get to that place where we're not consumed, because I do have three small children whom I adore and want to have more time for. This is my effort to buy back my time and then continue to buy support staff and then productize our services in some way. And I still haven't fully wrapped my mind around what that's going to look like. But I do know that there's a huge piece of facial rejuvenation. Yes, it is on the surface. And that is why I think traditional medical people, I used to be one of them, that poo poo the significance of this. But really, what people are wanting is to feel better about themselves. And when they feel better about themselves, they put more joy and good out in the world, right? And so, and helping people understand this, that this is just a different version of self-care as opposed to this superficial
It's not about the lipstick.
vanity. because it's tricky. What I tell all my women is it's the things that happen to us with maturity, they're not considered as flattering as they are for men. So
No.
helping, right? And
Looking
so
distinguished as a woman does not, those two things don't usually happen in a sentence.
that's exactly right. And so, and especially all of us have been growing up being told that we're pretty, being told we're lovely. And so, of course, we want to still hear that. What of it? So, somehow, I know that this is a part of the growth is somehow expanding on this word, whether it's a book, whether it's more of a podcast. I haven't wrapped my mind around that part, but that's going to be part of the growth. And that is actually, I think, how we've built our business to the point that we have with very little marketing, if any, and mostly referrals because people trust us because of our positive intent, which is very real and authentic.
One of the things I say, and that feel free to use it, is that nobody finds me by accident.
Mm,
We don't do
I
ads.
love that.
We are complete word of mouth. People find me because they resonate with me. We do a ton of weight management in my practice, and people know when they hear me that I get it. And I get it in a place. It's not about the weight. It's
That's
not
right.
about the weight, but it's not about the weight. Just like having your face look better, it is your interaction with the world. It is
That's
your
right.
interface.
Yes.
When you
Yeah.
look in the mirror, that's who you see. You want to see whether it's weight loss or facial rejuvenation, you want to see the real you. I love walking around in my skin 55 pounds lighter because now I'm
Yeah.
like, this is my real self. This is
That's
my
right.
body.
Yep. And it's
This
no
is how I'm
different.
showing up.
Yeah, it's no different than choosing a brand of clothing, the car you drive, your fitness, your makeup. It's semi-permanent makeup if you wanted to look at it like that. I actually have a family member with pretty significant body dysmorphic. So if you'd have told me 20 years ago this is what I'd be doing for a living, I would have just laughed and laughed because I was so turned off by the whole thing. And after having a baby, I got a job very close to home. It was a good opportunity. I wanted to work in medical derm, but they only needed an injector. So I thought, well, I have some experience. It's not my passion at that point. But went in there, and this is a college town in Chapel Hill, and all of these women, these accomplished academics, CEOs from the triangle of tech companies, they all came in with the same mission of just wanting to be treated the same as they always had, to be treated with respect, to not feel dismissed. And whether or not that was real for them, these treatments helped them show up in a way that they did not feel that way, right?
That's it right there. Because I'll have people say, oh, I'm treated differently than I was when I was heavy. I said, you act differently
Yeah,
than you acted.
that's right. That's
You don't
right.
show up the same way.
That's right. That's right. And there is statistical evidence that there may be a grain of truth to all of these things, but our energy, as Dan says, our frequency is what we see. It's what we're putting out there that we get back. So that whole energy shift has been huge for me personally, and as I bet it has for you.
Yep. And no, and it is. It's a true energy shift. You're on a different plane. You're on a different frequency.
Hmm. Yeah.
That when you show up and you expect, so and I spent 40 plus years fighting food, or not really fighting. It was my constant companion because it was soulless for me. It was my solution for just about everything. And I have very deep grooves in that. And showing up on the other side of that. And I had been lean before. It was an up and down thing, but you can't hold it when it's done by force. When
No.
you allow something, the energy is very different than when you're forcing it.
It's true. It's true. And I think so many, I mean, I have certainly struggled with food at varying points in my life. And it's identifying that whatever that trigger is for yourself, it's a lifelong journey, right?
Yeah.
Because the trigger can change
Yeah.
and it's an old thing for most of us,
Yep.
right?
And it's
And
not
food
going
for
away. It
women.
has to be managed.
Yeah, that's right. And it changes. I mean, I am 49 years old and I have a 5-year-old daughter. And that shift to try to I've always exercised. I've always had fitness in my life. But this was different, entering into a different phase. I couldn't just exercise. I couldn't just eat healthier. It took me years to get back to pre-baby weight and to actually again feel good in my own skin. And people are like, "Oh, but you look great." It's like, "No, no, no." But I want to feel like myself, just like what you
Yes.
said.
Yes. And from your standpoint in your profession, it's about I'm sure 99 out of 100 patients you see, their friends, their family, their coworkers would say, "You look great. What do you mean?" they don't feel like the expression of themselves that they see the potential of.
That's right. That's exactly right. It's so empowering to understand that and be able to have agency in that.
Yeah, yes, and you can make a difference.
For sure. For sure. Yeah.
And people, and I had someone on a live this morning actually ask me, "Hey, I have these stats. Would you take me on as a patient?" And I said, "You're not numbers. We talk, we figure out why you need what you need, but nobody finds me by accident. That's
That's right. I love that. And I've heard other incarnations of that. The practice that you attract is a reflection of you.
yeah, for better or for worse.
For better or for worse. So yeah, and I have some funny sayings about that. But I mean, and on that note though, I feel so fortunate, as I know you do, that our patients are wonderful. The dermatology PA that I just hired, she was very reticent to join, but she came in and shadowed me and she was like, I can't believe how awesome your patients are. I was like, I know, right? They're so cool, they're so fun, they're easy. I mean, it's not, and having a preference is not being difficult. That's just having a
No.
preference. So
It's being educated, asking questions,
exactly.
and
That's right.
being the healthcare provider that they can talk to and get their questions answered and feel comfortable in that environment is huge.
Yeah. Yeah. So, what are your favorite methods for helping your patients managing food and weight?
My absolute favorite, I'm not gonna lie, is tirzepatide.
Yeah. Okay. Great. Well, we started offering that late in the year last year. So
Yeah.
terzipatide. Yeah.
And that's just that's been my experience. Originally, I thought, oh, once I hit goal weight, which I really despise that term more than
Yeah.
I can express,
Right.
because it's not about the number. It's not.
No.
And my body settled in where it feels healthiest,
Hmm.
which was actually lower than my goal weight. I didn't see that coming.
Mm.
Again, I allowed it. And that's what I talk to my patients about. They're like, I'm at a stall. I'm like, hold on, back it up. You're not in control.
Yeah.
Your body is
Right.
going to settle where it needs to settle. And some people don't need it forever because, people talk about, oh, is it a lifelong drug? Well, here's the deal. It's not a weight loss drug. I was diagnosed with heart disease in November, and that was a bit shocking to me, to say the least. This class of medications reduces cardiovascular mortality by 20%.
Yeah. It's
So
so
when you
significant. How can you not?
20%. So why would I not stay on this drug at the highest tolerable dose
I know.
forever?
I know. I know. It's such a. I have never been one for medical weight loss in the sense of putting women on a bunch of stimulants. And I know, when desperate times call for desperate measures, but
Right.
I have never wanted to. I'm so conservative and careful myself that I think those things can change people neurologically too, especially if they're on it for long term. And so to have found all of the benefits of that class of drugs is amazing. Amazing, right? And how can you can't not put someone on it when you have such great data about the cardiovascular benefits, the neurological benefits, the decreasing the drive for food, and all the other things that are just horrible for us, right?
Yes.
Yeah,
We've
love
spent
that.
40 years as a society, and we got to a point where our children, I have an 11-year-old, and we got to the point where our children's lifespan was going to be shorter than ours because of what we are doing to ourselves.
That's right.
And this class of medications has interrupted that drift,
Yeah.
and that is no longer our path.
Right. What are you seeing these days about its anti-inflammatory effects? There's a lot of buzz about microdosing for autoimmune disease because of all those anti-inflammatory effects. What's been your perspective?
So there's, as far as I know, and I mean, this is obviously what I do all day, every day, but the micro dosing, people are actually talking about like a half of a 2.5 dose, which is the starter dose. To me, like I think microdosing, I
Hmm.
think like homeopathic dosing. But the inflammatory reduction with CRP, for
Hmm.
example, like actual blood testing for inflammation factors, was actually highest at the weight loss doses with semaglutide. So 1.7 and 2.4 are the actual weight loss doses. The actual weight loss doses are higher, and the inflammation reduction appears to be in the studies dose dependent. So people who are microdosing now, I
Interesting.
do have patients who have either non-specific colitis or Crohn's or ulcerative colitis that have decreased their biologics, because we know the dangers with biologics and the
Yeah.
immune system
Yeah.
reduction. They've been able to
Right.
decrease those doses by staying on 1.25 or 2.5 of tirzepatide. I wouldn't personally call that micro dosing. It's a lowest tolerable dose.
Right.
So
I
that's
love
what
that.
I've seen. Yeah. I mean, the thing is, I've been in maintenance. It's not about the weight, but for a year and a half. And I still have the food fights, the food battles, because those are 40 years old. My neural pathways are very, very well paved.
Yeah.
There are some weeks that in maintenance, I have to go up because it's about the food noise. It's about the management of my stressors. Am I getting enough protein? How is my hydration? How is my
Yeah.
sleep?
Yeah.
At
Yeah.
51, sleep sometimes isn't fantastic.
Oh my gosh. Tell me about it.
So I mean, I've found great things. We've treated over 5,000 patients in my practice with GLP-1s to this point.
That's an
So
impressive number.
yeah, and if we had kept them all, it'd be even better.
Yeah.
Gets
Yeah.
expensive for a lot of people though, which is why I'm really hoping that the drug companies, come on, bring it down, guys,
I know.
please.
I know. I know. That dynamic in our country is very frustrating. The inhaler that I had been on for 20 years, they change, and the generics, they're simply not as effective, and or they make it so difficult to be accessible between insurance companies that are for profit or the drug companies. And of course, the whole argument is no one's doing research in the world the way we are, and so it costs more because we do more. Um,
But
I
also we
don't
do
know.
more because our public is not willing to accept any risk.
Yeah, for sure. For sure. Oh my gosh. I know it's like a whole nother, you hear about in other countries, the way that medicine is practiced, and the providers aren't as scared to try to help or to do things,
Yeah,
because
to
it's
do the
kind of
best they
understood.
can.
Yeah, that's right. It's understood there's risk.
Yeah, that's why we call it practicing medicine, guys.
That's right. That's exactly right. The art of it. I mean, holy smokes.
And it is an art. It is an art for sure. So
Yes.
I think the biggest takeaway, tell me if you have a better one or a different one, different take, is that how you show up in the world is how you show up in the world. And that's the energy you're going to put out there. And both of our practices, I feel, really work to put your best self forward because then it goes inward and then you reap the benefits of that.
That's exactly right. You nailed it. You nailed it. And that's actually why we introduced the GLP-1s, because to come full circle, it's great if you feel great about your face, but if you don't feel great on the inside, if you can't close that loop, that's the opportunity there to feel as good on the outside as you feel on the inside. And then to show up in the world the way that you want to attract more of what you want, right?
Yes. Take up space. You're allowed to take up space.
Yes, that's right. And that's a tough thing for a lot of people. It's a tough thing to get comfortable with. And I get it. I've been there.
Yeah, agreed. Agreed. And it's great to find providers that help people meet people where they are. We know we've been there, we know what it feels like.
Yeah.
So if someone is looking for currently in person practice with you or down the road where they want to find more about you, relate to you online, to know I love the presence of this woman, how would they get in touch with you?
Absolutely. So we do offer virtual visits for skincare and dermatology. You can schedule online at thecuratedaesthetic.com. And if you would like more of our educational content or more information, more dialogue, you can follow me at the English Aesthetic on Instagram.
I love it. Thank you. And thank you so much for your time today. I appreciate you and appreciate what you're doing for so many people.
Hey, thank you so much. I appreciate you and what you are doing. It's like-minded hearts. So
Yeah.
thanks so much for having me. Appreciate you.
We'll change the world one patient at a time.
That's right. That's right.
All right. And for the listeners, go find English, send our message, The Curated Aesthetic,
Yep.
and we will see
.com.
you next time.
Yeah. Look forward to it.